Hi, it's Edward McEachern, Chief Medical Officer at Pacific Shores Health Plans. Today, I'm going to talk about what about schools. We've got a lot of stuff ahead of us in this lecture. I got to tell you, this is one of the hardest lectures I've had to put together. And I'm going to tell you a little bit about the decisions we made in our family and how we did it, given all this data. And so what I'm going to try to do, this is sort of we're between the devil and the deep blue sea. There's a least bad choice here to make, and there's not really any good choices. And so what I'm going to try to do today is lay out the data for you to understand the kind of things that might affect your decision making. I want to remind you there's another thing in our video blog that you might want to take a look at. It's called Understanding the Risk Factors to Make Better Choices in the blog. It's about your personal risk gate and map, and I'm going to come back to that in the lecture. And again, I'm going to talk to you about how we synthesized this in my family to make the choices that we made, and maybe they're the best choices that we could make, but they're the least bad choices we have at this time. I always want to give you reliable, factually accurate, and actionable data. I want to talk today about COVID in kids, the effects of social distancing and learning on children, and the effects of the psychology and economic impacts of COVID. Key unifying principle here is real simple. Public health is a means to economic recovery and safe education for schools to reopen. So we have to so ultimately, this lecture really is about your trust in your community's ability to promulgate its public health efforts. Also, I want you to remember that this is a respiratory pathogen. It's like tuberculosis or like influenza. And time, space, people, and place are the things you ought to be thinking about. How much time do you spend in a place? How much space is in that place? How many people are there? And what kind of place it is, inside or outside, make a big difference in the spread of this pathogen. One article that looks at this stands out to me, and it's an article that was done, just published actually in late July, by the International Coalition of the Performing Arts Academies. It's on aerosolized particles, and actually this is true for singing. It's also true for loud speaking. And so the first panel here in a room shows you looking down on a person in a room 4 by 5 meters, so that's a pretty good sized room. How dispersed aerosolized spit becomes in a period of time. 10 minutes, 30 minutes, 60 minutes. And if you look at this this picture in a room with a good ventilation, the aerosolized particles of spit that can contain, in this scenario, either influenza or the COVID virus, at 60 minutes without a mask, are pretty well dispersed in the room. And I'll show you some other data that shows and supports that. If you have a mask on, it has a very protective effect, and so you might want to think about masking. Second study I want to talk about is from Hermiston, Oregon. Hermiston's a little town in the eastern part of Oregon, and they did this thing called a trace study. Essentially what they did is they went and went into the community, knocked on doors, and said, hey, can we test your ability in your household to have COVID? Done July 25th and 26th, 2020. 250 or so houses were tested, very statistically significant for the community. Some good news and bad news here. 80% of the people that they found had COVID were asymptomatic, which means that maybe this disease is not as bad as we thought it was, but on the other hand, we have a bunch of people who are doing asymptomatic spread. Bad news was 17% of these households in Hermiston had a COVID positive person. So that's 1 in 5 households. That's a big number. So bottom line is very widespread disease in some communities. Next study comes from the Morbidity and Mortality Weekly Report, came out July 31st, 2020, about a bunch of kids who went to camp in Georgia, about 600 kids, a little more female than male, average age was 12. What they noticed was that if a kid in a cabin got it, and these are cabins that have open air, it's hot in Georgia in the summer, so they're open to the air, so if one kid gets it, the whole cabin gets it. Even though they tried to do multiple measures in the camp to prevent spread, people got it. And the bottom line here is, in contradiction to the literature that was prior to this, is that kids of all ages are susceptible to getting COVID and spreading COVID. Third thing, the third article that I saw was from the Oregon Health Authority. It was published July 27th, 2020. It actually looked at rates of kids getting COVID compared to the general population. Turns out kids in the general population have COVID in the same rates. Interestingly, in all adults, this is the history of all of Oregon's experience. About 10% of the people who got COVID went to the hospital in adults. And of course, that's skewed to the older 7th, 8th, and 9th decade of life, more of those people go to the hospital than the younger folks. And I'll talk about that in a second. Kids went to the hospital at about 1.5% to 2%. Well, that's good news compared to the adults. That's still a massive number when you compare it to almost any other disease. That's 1 in 50 to 1 in 100 kids who gets COVID goes to the hospital. The long-term consequences or sequelae of this disease are not well known, and so we don't really know what that means for these kids long-term. It just means they went to the hospital. Kids get COVID in their home and in their neighborhood. That's kind of where the kids get it. Also, when kids get COVID, increasingly the data shows that they are asymptomatic. They have less symptoms than adults, and that's kind of rare for this kind of disease. I've noted before that this disease, unlike many other diseases, spares its young, and so that's probably good news. Bottom line on respiratory spread, about 1 in 5 people in some communities have it. If kids are in a well-ventilated room, if one kid comes up with COVID, there are many who will likely have COVID. Hospitalization rates for COVID in kids is relatively low, but the long-term consequences of COVID are not known. And from my past talks, you might remember, if you're healthy in your 30s and 40s, you have a 1 in 100 or 1 in 50 chance of going to the hospital if you get COVID. So what are some other things that are 1 in 100 or 1 in 50 chances of occurring? So if you're 40 years old, you have a 1 in 100 chance of having a Down syndrome baby. If you're a base jumper and you jump off of a bridge, you have a 1 in 100 chance of injuring yourself. If you drive a car for 50 years, the average of 12,000 miles a year, you have a 1 in 100 lifetime chance of dying in a car crash. Some places, some things that you can use to put in perspective. Super spreader events occur when many people are indoors. What's a school? Many people are indoors. It's a super spreader event setup. Testing is at or past its limits in the United States. Right now, and talking to a number of the people around in the commercial labs and the state labs, I think we're in a world of hurt for testing as we go into this fall. Well, what about the economic costs of COVID and school closure? Well, they're pretty high. If you look at the United States workforce, about 16% of the people who are in the workforce are the main caregivers for their children. The school closure, when it closes, about 30% of the essential workers are the main caregivers for their kids, and so you're putting these adults into a place where they have to choose against their essential work for the kids' health. And it's important to understand the economic costs. In the UK, when they closed schools, the GDP went down 0.2 to 1%. In the United States, over the last time since February, our GDP's contracted due to school closure about 3%. Remember, education is one of the strongest predictors of health and wealth, in both individually and as a country. And so closing schools is probably not an option. What about if we close the schools, does it really affect the spread of disease? Well, this was one that I had a hard time looking at. We looked at the literature. The results are contradictory and not well known here. But if you look at with influenza in Seattle, they had a bad outbreak. They closed the schools and it decreased the infections 5.5% in Seattle. About a third of the transmissions for influenza and tuberculosis in older studies occurred in schools. And using school closure, along with many other measures that we're now familiar with, decreased the rate of spread with an R less than 1. And so I think school closure only works well when you have it done with a whole bunch of other things as well. Bottom line for school closures, it has a large effect economically and socially. It affects spread only in conjunction with other measures. My reading of the popular presses in the literature right now leads me to believe that the school systems are going to be under a lot of strain to stay open this fall and spring. And so it's between the teachers feeling safe, kids having COVID, staff getting sick. So what we might want to do is expect to have this sort of zigzag between open and closure and figure out a sort of a through line of play. And it might even be more sense as you make your own personal plans to think about how you're going to live with this sort of mismatch of open and closures and figure out the best educational opportunity for your learner in that as well. Psychological costs of kids are high. And a couple studies from Europe showed that about 25% of the students in the university got high anxiety related to COVID. One of the things that helped, a couple things that help, social supports, physical exercise, and unfortunately playing games on media entertainment health as well. There's a lot of literature about distance learning in kids, and it's tough. We all now know that. Distance learning is really tough on kids. Older kids have better outcomes than younger kids. The literature I looked at said the 9th grade on up, kids have a better ability to learn distance than younger. Males fared much worse than females in distance learning for a lot of reasons. And any child with any kind of learning disability fares very poorly with decreased interaction in the classroom. Remember, I talked about the time, space, people, place framework. I'd urge you to take a look at that video. It asks you to think about your physiologic risk, your community risk, your lifestyle risk, and event risk, and then make some decisions, and gives you a framework for making decisions about that as well. So what did we do in our house? I have 3 children who are all college age. One is a really good learner and will stay home this year and not go to college this fall. One has a very wide social circle and learns better in the tactile and in-person learning, and one child learns best in that environment. So 2 of our kids are going to go back. One of our kids is going to stay home. We plan every week to take a check-in point and see how things are going, and begin to take a look at the community's COVID response and the school's response to COVID, and see how we're doing. I think they've got, both of these schools that they're going to have pretty solid plans about that. Well, what does society need for us to do this work? We need to stay in the dialogue that the science community is having right now as we discover new facts about this novel virus. Surveillance is going to be really important. The ability to identify, test, track, and trace, and isolate people is going to be huge. Sufficient and rapid testing and reporting is going to be essential. That's a problem right now in many of our communities as the testing reagents become less and less available. Despite good progress around that, we've had a strain on that system as well. Accurate data, predictive modeling, robust system of public health in our communities will also be good. I'll encourage you to continue your hand hygiene, your physical distancing, and your environmental decontamination. Those are important. Mask wearing turns out to be a good predictive value as well. Again, Edward McEachern, Chief Medical Officer at Pacific Shores Health Plans. If this is helpful, please share it with some of your friends.